How is a lymphoma lymph node biopsy performed? Imagine trying to solve a mystery about what's happening inside your body. A lymphoma lymph node biopsy is a key step in uncovering whether cancerous cells are present in your lymph nodes. To do this, doctors can choose between two main methods: needle biopsy or open surgical biopsy. In a needle biopsy, the doctor first cleans and numbs the skin over the affected lymph node. Using imaging tools like ultrasound or sometimes computed tomography scans, they guide a thin needle into the lymph node. The goal is to collect a small tissue sample or fluid. There are two types of needle biopsies. Fine needle aspiration uses a very thin needle to gather scattered cells, but it often doesn't preserve the structure of the tissue, so it is less common for diagnosing lymphoma. Core needle biopsy, on the other hand, uses a larger needle to remove a small cylinder of tissue. This method keeps the tissue architecture intact, which is very helpful for accurate diagnosis. After the sample is taken, pressure is applied to stop bleeding, and a bandage is placed. This procedure is minimally invasive, usually done as an outpatient, and recovery is quick with only mild discomfort possible afterward. The other option is an open biopsy, which is a surgical procedure. This is typically performed in an operating room or outpatient surgical center. Under local or general anesthesia, the surgeon makes an incision to remove the entire lymph node or a large part of it. This method provides a bigger tissue sample and preserves the lymph node structure, making it easier for pathologists to identify the type of lymphoma. After removing the tissue, the surgeon stitches the incision closed, and the patient may need some recovery time. Open biopsies are often chosen when needle biopsies do not give enough information or when a more definitive diagnosis is needed. Lymph nodes are small glands that filter lymph fluid and contain immune cells. When lymphoma develops, these nodes often become enlarged and contain cancerous lymphocytes. Imaging tests like ultrasound, CORT scans, or PET scans help doctors select the best lymph nodes to biopsy. Once the tissue is collected, it is sent to a pathology lab where specialists examine it under a microscope. This helps confirm whether lymphoma is present, determine its subtype, and guide treatment options. While risks are rare, biopsies can sometimes cause bleeding, infection, or discomfort. The choice between needle and open biopsy depends on factors like the size and location of the lymph node, how accessible it is, and the clinical situation. Both methods aim to obtain enough tissue to make an accurate diagnosis, which is essential for planning effective treatment. Remember, always consult healthcare professionals for personalized advice and to determine the best approach for your specific case.